you. I'm honored to be here, and I especially want to thank SAP for inviting me and the distinguished guests for having me here to speak. We are facing a crisis right now in the world, and not just in India, but in every place, including where I'm from. And so, after discussing with the SAP leaders, the SAPCON leadership, we decided to switch and talk about something that is a challenge, coronavirus 19, and talk about some of the myths, the facts, and the fiction that are out there regarding this. So I have enlisted two people to help me out. There we got one and two, and they are going to be going through the audience, and they are going to be asking the audience members to say whether it is fact or whether it is fiction. So we pulled a bunch of information, both from social media, from the WHO, from the academic papers and other sources to come up with these statements that are being circulated, because they can be very dangerous or very helpful, depending. So let's take the next few minutes and talk about what is called COVID-19. You may have also heard of it as SARS-CoV-2, but the name officially now is COVID-19, Coronavirus 2019. The other coronaviruses that most of you are probably familiar with is MERS and SARS, and those have caused major outbreaks across the world, but nothing like we've seen with this one. I pulled this today. As of this morning, there is over 100,000 confirmed cases of this disease in just a few months when it started in December of 2019, with over almost 3,500 deaths. And if you look, those outbreaks are very heavy in the East Asia, China region, Europe, and what we're seeing right now on the western part of the United States. Too loud? Too soft? The direction. Okay. So with that, India, hopefully, will continue to be what we call spared, but it also needs to be prepared. And the group that needs to probably be the most prepared are EMS providers, prepared to take care of their patients, to get their patients to the right location, to take care of themselves. Because if you as providers do not take care of yourselves, you risk actually being a key group that can spread this infection across the country. Right now, we're very lucky. There's only been 31 reported cases according to this, and 0 deaths in India. But just like in the United States, this number can go up very quickly, and we're starting to see a rise in this number. So I'm coming from the United States, so you're going to see a lot of me doing this instead of shaking hands, because I'm worried about getting someone else sick, right? Not about getting myself sick, but about getting someone else sick. There's been about 300 cases in the United States, a lot of them from the area that Dr. Gautreau, Dr. Mahadevan, and myself come from, on the West Coast in Los Angeles and San Francisco and Seattle. And there's been 14 deaths to date, and it is rising. With our first case at Stanford Hospital, and our first doctor, I should say, not our first case, but our first physician at Stanford Hospital has gotten sick with this illness. So with those words, let's get started breaking down some facts and fiction. So I'm going to have my team go through. Here is the first statement, and then they are going to pick someone out of the crowd to say fact or fiction. Spraying alcohol or chlorine on the body prevents spread of this disease. Everybody should think. We're waiting for the audience member. I'm getting no response. Let's hear it.
It's a fiction.
Fiction. Most people say fiction. Fiction it is, okay? Spraying alcohol in the body does not prevent this disease, or spraying chlorine. Wiping your hands with 70% alcohol kills this virus, COVID-19. Fact or fiction? I heard fact. Okay, I got a different fact. People don't want to use the microphone, so I'm going to switch it up. I want the entire audience to say fact or fiction after I say the statement, okay? Group participation.
Fact.
Fact. That is right. 70% alcohol is very effective, so that does not mean you all need to go get Russian vodka, all right? But if a hand sanitizer has somewhere between 60 and 75%, 65 to 75% alcohol in it, it is probably effective at killing the virus. But you have to let it dry. You cannot squirt it and then wipe it off, because it is during the evaporation of the alcohol that the virus actually dies. All right, next one. Cleaning ambulance with bleach after transporting a patient with COVID-19 can prevent infection. Fact or fiction? Ooh, people are not sure. You're ambulance providers, you have to know this one.
It's a fact.
It's a fact. That's right, it's a fact. So I know that EMRI has implemented this if they are carrying for patients that they are at risk for or being thought might be at risk for this, for cleaning that ambulance. Very important, okay? To clean those surfaces. And it's not just the ambulance surfaces, it is the surfaces of other things that you need to clean. The virus can live for hours, even up to days, under certain circumstances, on surfaces, like in this case a pamphlet, or on the table, right? So it can live for hours and occasionally up to days. And then you say, well, what can I clean it with besides bleach? And the truth is that this virus is very susceptible to most cleaners. So if you use most of the common cleaners, it will kill the virus. So just make sure you're using a good cleaner and it will work. How about this one? Flu vaccine can be used to prevent COVID-19. Fact or fiction?
Fiction.
I heard fact-fiction.
What?
Okay. Fact, it's actually fiction. That does not mean that flu vaccine is not important. In fact, it's very important, because we only have so much ability to test and to differentiate the flu from COVID-19. So the more flu we can prevent, the more resources we will have to combat COVID-19. So flu will not prevent this disease, but flu vaccine will not prevent this disease, but flu vaccine will help us combat this disease by saving healthcare resources, okay? So make sure that you're encouraging that. How about this one? Taking hot bath can prevent COVID-19. Fact or fiction?
Fiction.
I heard a lot of fiction. You guys are very smart. This is fiction, okay? Taking hot bath. Now, if you take a hot bath with soap, that will be helpful maybe. Next one. You cannot catch COVID-19 by items made in China. Fact or fiction? You cannot catch them.
No. I'm just thinking.
Fact. Items that are being made in China do not have the COVID-19 on them by the time they come to you, okay? They are safe. That doesn't mean you shouldn't buy India first. How about this one? You can catch COVID-19 by drinking Corona beer.
No. Fiction. Fiction.
Fiction. Well, we'll see. They did a survey in the United States. They went to the street and they asked people. They say, if you drink Corona beer, will you get coronavirus? 30% of people said yes. we need more education, okay? It's safe to drink Corona beer, but not too many, all right? And not drive. It's fiction. How am I doing for time? Okay?
Yeah, you're all right.
Okay. How about this one? This one I saw on the social media. I try to stay off social media, but this one came to me. Keeping your mouth moist will prevent infection because when the virus gets in your mouth, you will then swallow it and it will go into your stomach and the acid will kill it. Fact or fiction?
Fact. Fiction.
This one came out of, has anybody seen this one? From Taiwan it's coming, I think. Professor? Okay, a couple people. It is fiction, okay? There's no evidence to tell us that drinking water, which is good for dehydration, will prevent you from getting it. This one I saw in the paper here. Yoga can prevent COVID-19. Fact or fiction? I heard fiction, but it still can prevent heart disease. So make sure you're doing your yoga, okay? Good.
Yes.
And let's do one or two more, and then we'll take a break. We'll have some other speakers, and I will finish this fact or fiction later. Wearing a mask in public will prevent infection.
Fact.
Fiction. Masks are selling out in the United States, China, India, everywhere, right? But if you're like Maha and you don't wear a mask, instead of being like me, the mask generally will not prevent infection. And this is very important. This is what I want you to learn right here. This virus is not in the air. It is in droplets. Now, maybe in the future it will be able to be in the air, but right now we don't think that's possible. So it is on your hands. It is on the desk. It is on this. Your phone is carrying a lot of virus, not just on the software, but on the hardware. So if you take care of your hands, you avoid touching your face, okay? You use good contact, what we call contact precautions, okay? You can help stop the spread and keep yourself and your family and your patients safe. Most of the spread is actually in the healthcare environment or in people's homes to other close contacts via hands and droplets. If someone is coughing a lot, we should put a mask on them. If you're seeing a patient who is coughing, you should put a mask on yourself also. But if the patient is not coughing at all and they're breathing and you're breathing, you're not going to probably catch the virus. You're going to catch the virus by your hands and someone that is coughing. Is that clear? All right. And then 2 on spreaders. Super spreaders, some people are infecting many people. Fact or fiction? Fact. Let's see. People that work in other people's homes or environment, contact a lot of people, maybe touch them very closely. They can spread this to a lot of people. Every person in this room could be a super spreader because every person in this room has the trust of the community and the patients to come into their home. So you need to take extra caution. And then lastly, silent spreaders. People with no symptoms can spread the disease. Fact or fiction? Come on, fact or fiction?
Fact.
Fact. There was a lot of debate about this, and I don't think it's very common. But the US, especially, Centers for Disease Control, said, no, this is probably not correct at first. China was saying, we think so, and the US was saying no. But now it looks like this is a fact, and that early in the course, with very few to almost no symptoms, people can spread it. So you need to take general precautions, okay? All right, and then we'll stop there. So I want to thank you very much, and I want to let our next speaker come up. Thank you, Dr. Maha. and thanks again to the organizing committee of SAP for inviting me here to speak. And that was fantastic, Dr. Rajans. I learned a lot about where we're at with EMS legislation in India. So we are going to touch back on COVID-19 like we started yesterday. And I had been, a few people approached saying they had some questions. And so I will answer maybe some of those questions during the lecture. And if we end up not covering them, I'm happy to take questions afterwards or during the break as well. And as you may find out, I don't have the answers to everything because I don't think we as a world yet have the answers to everything. But before we get started, I just really want to acknowledge what a few of our speakers have acknowledged today, this very important, auspicious day of International Women's Day. So please give a round of applause. This day is important in every nation, but no nation is it more important than in India, where it is a constant fight for equality and equity for our female colleagues, friends, and loved ones. So let's get started with a question, a fact or fiction. Do you remember we're doing fact or fiction? And so I'm not going to have people walk around with a microphone, but that means you have to yell out fact or fiction. And if you all yell, it won't matter if you're wrong because no one will notice, all right? Okay, so first one, correct PPE, personal protective equipment, when caring for possible COVID-19 includes masks, gloves, eye protection, gown if available. Fact or fiction? Rawr. Okay, let's try that again. Fact or fiction? Fact, that is right. So it's important. So yesterday we talked that a mask may not prevent, if you're just walking in the community, may not prevent you from getting it. But when you're caring for a patient and they're getting oxygen or they're coughing, a mask is an important part of your protection, as is eyewear or glasses. So I specifically wore my glasses and not my contacts while traveling for that reason. All right, here's one. When providing nasal cannula oxygen to patient, you place the tubing and then you put a mask on to avoid aerosolizing. Now, so aerosolizing means putting the virus into the air, not in droplets, like when someone sneezes or coughs, but actually putting it into the air. So when you're caring for a patient, should you put the nasal cannula on to give them oxygen and then put a mask over them or not? Fact or fiction? Ooh, nobody knows. It's a fact, okay? So at Stanford, we're having a policy that most of these patients, if they are coming to the hospital or on your ambulance, may have a low oxygen level, right? Struggling to breathe. So you put oxygen on them. If you put the nasal cannula on them, that pushes pressure into an area where the virus is. And so you might get it into the air. So it's good if you can then to put a mask over the patient. And of course yourself. Now, what about if the nasal cannula is not enough and you have to put a mask on them? When providing face mask oxygenation to a patient, we suggest using non-rebreather face mask to avoid aerosolizing COVID-19. Fact or fiction? It's better to use non-rebreather versus rebreather. Fact or fiction? Nobody knows. Fact. So our current recommendation again is, if possible, if you have to move to a mask, use a non-rebreather mask, okay? First I would try nasal cannula with the mask. Let's try another one. This one's straight from social media. Dogs and cats at home can spread COVID-19. Is that dog going to cause us to have COVID-19? This one right here. Come on, fact or fiction? Okay, good. I heard some friction. So a little bit of fact, a little bit of fiction. The answer here is fiction. Okay? There was a dog that tested positive supposedly for this in the dog urine or saliva or something, but that is not where this virus resides. It's not in your pets at home if you're talking about dogs and cats. So dogs and cats are safe. They can continue to give you kisses, and you don't have to worry about them giving you COVID-19. This is a complication. This virus is believed to be a complication of the interaction, though, between humans and animals, that One Health, right? So this virus is a bat-borne virus, likely. It's where the virus normally resides is in bats. And that was actually true for SARS also. Now, it's believed that it actually moved to a different animal, and then from a different animal, it came to humans. And in places where there's a lot of interaction with animals, or where people are eating or ingesting animals that are from the wild, it puts them at higher risk. Some people have said, what animal is this? Anyone? Pangolin, right. So some people have said it went from bats to pangolin, but we don't know for sure. Okay, fact or fiction? Mosquitoes do not transmit COVID-19. Do not. That is a fact, okay? Mosquitoes do not transmit COVID-19. How about this one? Trust of India, PTI News. Cow dung and urine can stop the spread of COVID-19. So we spray with cow urine. Fact or fiction? Fiction. Thank you. Dr. Rajans is like, come on. Fiction. Yes, but it's, this is a prime example of where we need to be careful when we are reading social media for both things like COVID-19, but also on how to care for our patients, right? It's good to make sure that you have a trusted sources that you can go to and are not just reading anything on WhatsApp or Facebook when it's not from someone you know and trust. All right, almost all people with COVID-19 develop symptoms. Remember yesterday we talked about people without symptoms, could they spread it? And we said yes. What percent of people, this is obviously early in the disease, but right now, do most people get symptoms or not? That's this question. So is this fact or fiction? People will almost all get symptoms. I heard fiction, mostly. I heard a lot of I don't know. This is actually a fact. So this is one of the things that's good for us as we battle this disease, is that almost everyone appears to get symptoms. They did testing in China, number of places. In one place, they tested 15,000 people from the community that did not have symptoms. Only one of them had COVID-19. So we think the rate of people getting the disease and not having symptoms is probably 1% or less. The vast majority of people are going to get symptoms. Now, we don't know for certain because it's early, so maybe this will change, but it's good news that most people will get symptoms, but they might be able to spread it before those symptoms start. How about this one? Fact or fiction? Most patients have a fever with COVID-19. Fact or fiction? Fact. Good job. You guys are reading the right sources. Good. So most patients with COVID-19 will have a fever. How about this one? Sore throat is a common symptom. Okay. Wrong. Fiction. All right? This is actually fiction. And the reason that I throw this one up there is because every source that I read keeps saying sore throat is common, whether it's the social media or even some of the documents from the WHO or things like that have said, hey, sore throat. But if you look in the literature, sore throat is pretty uncommon, actually. So they keep saying it's like the flu, but it really doesn't have the same symptoms as the flu as much. There's some overlap, but it's a little bit different. So let's look at the symptoms. About 80% of patients will get a fever, maybe up to 90%. Okay, 80 to 90% will get a fever. But in a study in China, When they looked at 1,000 cases of COVID-19 patients confirmed that came to the hospitals, only 40% had a fever when they came to the hospital. The other 40% got a fever during their hospitalization. So you can't count on every patient having a fever when you see them, all right, even though it's a common symptom. Cough is pretty common. About 70% will have a cough, about 35% will have a dry cough, and about 35% of those will have sputum production. And then breathlessness is the other one we think about. Maybe they don't have a cough, especially if they're elderly, but they are short of breath. So I think that one goes together. Let's look at the other symptoms, though, as a whole. Fatigue, just feeling run down or tired, 38%. Sputum, about half of the coughs will have sputum, 33%. Body aches. So when I think about influenza, I think of body aches being very common, right? When I see patients, I think almost all of them have body aches. But in this case, only 15%. Headache, 14%. That's different than flu, where it's higher. Sore throat, 14%. Congestion, 5%. And GI symptoms, nausea, vomiting, diarrhea, are rare in this, which is different from the flu again, with diarrhea being only 4%. So if the patient comes in complaining primarily of diarrhea, we need to think about our classic causes more than we need to think about this disease. All right, fact or fiction. By the time you have symptoms, it is too late to prevent lung fibrosis. Fiction. All right. So it is fiction. Most of the time, you'll get symptoms for a while before you get that sick. So what is lung fibrosis? Lung fibrosis is when there's injury to the lung, fluid comes into that area, and as the fluid is recollected, the protein remains, and it causes kind of a layering or a covering, which leads to distress of your breathing and low oxygenation. So here's the time course as far as we know it. You catch the illness. Most of the time after a couple of days, median is around day 5, you start to have symptoms. About another 5 days, 4 to 5 days, you can start to have more severe symptoms. So someone might look pretty good to start with on day 5 or day 6. You might even send them home in isolation. But that does not mean that they will not get worse, because most of the time they're around day 10 when they started to get severe. And then death can occur anytime from 2 weeks, about 15 days, right, up till even 28 days. And some of that's because we're prolonging their life, trying to help them in the hospital. So if you try to remember 5, 10, 15, okay? 5 days is the typical onset. 5 more days is when you typically get severe symptoms, and 5 more days is when you're at the highest risk for dying. How many people die with this disease? Fact or fiction? The case fatality rate from COVID-19 is 3.4%. Nobody knows. Okay. Fair enough. That's a very wise answer by you guys, because you're right, we really don't know. But if right now the WHO is reporting that this is a fact, the mortality rate is about 3.4%. Okay, and I'm going to talk a little bit more about that mortality rate, but let's go on to another fact or fiction first. Fact or fiction? Pregnant women and children are at a higher risk from COVID-19. Ooh, I hear a little bit of fact, a little bit of fiction, so we have a little bit of friction. The answer here is fiction. Fiction, interestingly. Remember that in the H1N1 outbreak, that was the case, that pregnant women were at a higher risk. And definitely with flu, the influenza, the very young are at a higher risk. But that's not been shown in this disease. In this disease, is very low rates of death in children, very low, right? Less than 10 like a week or two ago, there were no reported deaths less than 10 years of age from this. Now, that doesn't mean we're not missing it, but you can see that really, as the age goes up, the mortality goes up with this, okay? And it's really, once you start getting over 50 years of age, that you start to see that mortality rise. And in those patients over 70, it really starts to rise. So we got to be very careful. In the United States, they had the first major outbreak was in a nursing home. In a nursing home. So that's why in Seattle, that's why there were a lot of deaths there, because of the age of that population. All right, how about this one? If a person is fit and healthy, they will not get COVID-19. Fact or fiction? This is pulled from, you also won't get kidney failure, heart attack, liver dysfunction, according to the newspaper in India. Fact or fiction? Fiction. You can still get it. In fact, it is a risk factor for death and bad outcomes with COVID-19 if you have cardiovascular disease or diabetes or respiratory disease. But you can see that these rates of death, if you have nothing, the death rate is still about 1%. So if you have no known medical condition, your death rate with this is still approximately 1%. Of course, it's going to be different between ages. So what does that mean? It means that, yes, we should be worried about the patients that have things, especially cardiovascular disease. But if they do not have pre-existing conditions, they still could have a bad outcome. So we have to be careful with them. COVID-19 is more contagious than the flu, influenza. Fact or fiction? I heard fact. Somebody's been reading up. Good job. That's a fact, right? Fact. Let's take a look at that. So COVID-19 has what's called an R0. That means how many people will you infect when you get infected, on average? So with COVID-19, it's about 2 to 3 people. So if I have the disease, I'm probably going to spread it on average to about 2 to 3 people. That's pretty substantial, and it can grow very quickly from that. But if you compare that to the flu only has an R0 of 1.3. 1.3. So it's lower. So it is more infectious than the flu at this time, but it's not as infectious as some of the other things that we talk about, like Zika, or especially measles. Measles is the one with the very high. So important to get vaccinated because the average person with measles infects 15 other people. All right, couple more. 10-second breath test can test for COVID-19. So, you take a deep breath, you hold it for 10 seconds. If you feel okay, you are okay. You don't have COVID-19. Fact or fiction? Fiction, okay? Fiction. Remember, we talked about not having shortness of breath. You may not have always a cough. So this test does not work. Do not use it as a test to tell if you are in trouble. Antibiotics cannot cure COVID-19. Fact or fiction? Come on, answer. Fact. Good job. China is trialing favipiravir to treat COVID-19. It's an antiviral agent. Fact or fiction? Fact. You're right. So there's a trial going on right now about this antiviral agent that was developed previously. So people have asked me about Chinese herbal medicines, antiviral medicines. The one thing we know is that steroids doesn't work. Okay, no steroids. There's 60 to 80 other drugs being tested right now, but we don't know if any of them work, okay? Including any natural supplements or Chinese herbal medicines. Supporting breathing is the most important treatment for COVID-19. Fact or fiction? Fact. Good job. All right? So support their breathing. And make sure you do it early. One thing that's being stressed at Stanford is that we don't want to wait until they're very sick to need intubation to do it because it's a dangerous procedure. So we want to do it a little bit earlier than usual. All right, so remember, you're going to wear eye protection. You're going to avoid large gatherings after you leave this conference if it comes to India, okay? If it comes to India, avoid large gatherings. We are isolating people, and that is working. That is working for sure. We're going to keep our hands clean. Yes, Prasad, Dr. Rajan, thank you for demonstrating, right? We are going to wipe down surfaces. If we are taking care of a patient with this that may have this, we're going to wear a mask. And if we put oxygen on the patient, we might put a mask on the patient also. And then lastly, I just want to say thank you very much again for having me here today.
Thank you, Dr. Strehlow, for that fantastic lecture and rounding out our knowledge about COVID-19.